Hi, I'm Dr. Robert Herman. Today we are going to talk about 6 overlooked causes of digestive problems. Before we start, I would like to know, are you committed to solving your digestive issues? Are you committed to finally getting to the root cause of your symptoms? Are you committed to getting an actionable game plan to deal with the pain, the loss of productive time to do the things you want to do? If you stay until the end, we are going to show you how to quickly, affordably, and accurately pinpoint what's going on inside your body in less than 4 weeks so that you can finally get back to a normal life. Now, you may have been suffering from chronic issues for a long time, like Dawn and Laura, and you may wonder if it's even possible for you to resolve the underlying imbalances and unleash a life of full energy. But let me tell you, I've been doing this for 20 years with hundreds of patients. We have a proven, systematic framework that allows us to properly diagnose and treat patients in ways that their previous provider wasn't able to. So by the end of this video, you'll know exactly how to quickly, affordably, and accurately pinpoint what's going on inside your body in less than 4 weeks so that you can finally live your life to the fullest. Okay, let's start with a quick pop-up quiz. Are you experiencing any of the symptoms listed on this slide? Are you suffering from abdominal pain, chronic fatigue, or brain fog? Are you dealing with unexplained anxiety, constipation, or pain and inflammation? Do you have sugar cravings and sensitivity to foods? Okay, how many of these symptoms are you regularly experiencing? Now, when we're finished with this session, you will begin asking new questions, questions that you may have never thought about, questions that your current provider may never have brought up before. You'll also know the most common causes of digestive disease and what you can do to mitigate the future course of your conditions, oftentimes with natural solutions without prescriptions and pills. You will understand why the current approach is failing, and it will fail millions of people. You will know exactly what your next steps are, and you will be presented with a life-changing opportunity for attending today. Our entire medical system is based on symptoms and geography. We categorize people according to symptoms and geography. For instance, when you are having pain in your abdomen, pain is the symptom. We find the problem is in maybe your gallbladder. That's the geography or the location. So you were told you have gallbladder problems. No one thinks about the cause. You can have one cause causing 10 diseases, and you can have one disease that has dozens of causes. Just because you know the name of the disease doesn't mean you know the cause. For example, depression is a common name we give to people who are uninterested, lethargic, low energy, but it can have many causes. Depression is the name of the symptom, not the cause. The cause could be a microbiome imbalance, food allergies, low vitamin B12, low vitamin D, or maybe toxins. The current medical model does not allow us to address causes. That's what functional medicine does. By looking at everyone as an individual, you can address the cause of the symptoms. In the current model, you go to the doctor, they diagnose you with a condition, and here's your medicine. None of these medications fix the condition, the underlying condition. None of the medications stop the disease. They may slow it down, but they don't stop it. The new medicine, functional medicine, is let's go and get to the root cause of the condition. So one of my patients, we'll call her Jane Doe, is typical of many of our patients with digestive problems. She typically has had a problem for many months or years. she usually has a diagnosis of irritable bowel syndrome, or maybe inflammatory bowel disease, or perhaps the doctors have told her it's all stress related. She has undergone colonoscopies and usually other tests. She has tried medications and has suffered their side effects. How does functional medicine help Jane Doe? It helps by finding the underlying cause, often hidden, and then fixing the underlying cause. These are some of the most common overlooked causes of digestive problems. Stealth infections, autoimmunities like food allergies and sensitivities, mitochondrial dysfunction, nutritional deficiencies, chronic stress, and chronic inflammation. Let's explore some of these overlooked causes of digestive problems. Stealth infections are a common overlooked cause of digestive problems. Yeast, parasites, Clostridia, and in this test, Klebsiella are all infections that we find. This patient also had no growth of the normal, healthy bacteria, Bifidobacter. This patient had been to Mayo Clinic and still had her problem. After correcting these problems, her pain went away. The comprehensive stool test we performed also measures inflammation in your colon. It measures how well you are digesting your protein, your fats, and sugar. The test will measure your good and bad bacteria, so we know if you need a probiotic and what type you need. Short-chain fatty acids are produced by your good bacteria and are also measured. This is an example of digging deeper to find the cause. A dietary antigen test or food sensitivity test is a test we run on almost all patients. Health begins in the gut, so this is essential. We test 4 different types of sensitivities: IgE, IgG, IgG4, and complement. Complement is connected to autoimmune conditions. Sometimes the foods you are eating that you think are good for you are actually generating inflammation. This is a blood test and the highest quality dietary antigen test available. Eliminating these foods for a few months will reduce inflammation, reduce pain, and help with autoimmune conditions. The organic acids test is a urine test we perform on almost all patients. It gives us so much information. There are 77 tests which cover these broad areas: intestinal microbial overgrowth, including fungal, yeast, and Clostridia markers; oxalate metabolites. Oxalates can generate widespread pain. Mitochondrial markers. 9 tests to show how efficiently your body produces energy. We test the glycolytic cycle for how your body is doing, breaking down and burning sugar. We test neurotransmitter metabolites for mental health. We test folate metabolism or methylation. This is the way your body turns genes off and on. It also helps with detoxification. We test nutritional markers. We test for additional markers for how well your body is at detoxifying. We check your amino acid metabolism. These are the building blocks of proteins. This gives us an in-depth look into how your metabolism is working and, more importantly, how to correct it. In order to evaluate stress, we perform a cortisol test. This is tested in the saliva. In this case, the root cause was low DHEA, a hormone that makes cortisol, which is a stress hormone. This patient couldn't deal with stress and crashed at noon every day because she had a difficult time producing cortisol. For some patients, we do genetic testing. Genetic testing can give us great insight into difficult to treat conditions. This is a way to look deep into the metabolic pathways and to support the pathways that are not functioning properly. It doesn't matter if you have gut issues, thyroid problems, or chronic fatigue. By doing in-depth lab testing to see what the cause is, we can develop a plan individualized to you. We will develop a lifestyle and nutrition plan specifically for you. We develop a patient-specific nutrient protocol to restore your deficiencies. We create an herbal protocol to rebuild your gut health. We help you with mindset coaching to help you regulate your stress. We will make very important dietary changes, and your health coach will help you implement them. So this is what our process looks like. First, we need to gather information. You will need to fill out a new patient application. This application will guide us toward testing, so be as detailed as you can. There is no substitute for being thorough when it comes to fixing chronic health problems. You may need to sign a release form for past medical records. Next, we will meet either in person or virtually, and we will present a plan for testing for your specific problems. We will let you know exactly what our strategy is, and since we don't shock people, we will let you know exactly what the cost will be. Then you can make an informed decision whether you want to proceed. There is no cost up to this point. This allows you to see if you are the right fit for us and if we are the right fit for you. We don't accept every patient. We only accept patients that we think we can help. If everything is a go, we will proceed with lab testing. It will take a few weeks to get results, but this is not wasted time. Your health coach will begin helping you with dietary and lifestyle changes. We will begin to help you detoxify to prepare you for the changes that will happen after receiving the lab test results. Baseline supplements will help get this process going. After receiving lab test results, we will fine-tune your program. During your treatment, you will have access to Dr. Herman and your health coach continuously with HIPAA-compliant text messaging and email or by phone if necessary. We get it. If you have a question about a food item or something else, you need immediate answers. We have helped hundreds of patients regain their health and regain their life. There are answers to your chronic health problems. Wouldn't it be nice if we could do the same for you or for one of your loved ones? So, what are some of the things that you've learned today? Do you now see why it's important to get to the root cause of your problem? Why doing the right testing is important? Why you can never fix a digestive condition with medications? Why the current approach is failing so many people? Why personalized healthcare is the only solution? So the obvious question is, how do you put all the puzzle pieces together so you can start feeling better as soon as possible? There are two choices. Option A is to try to figure it out on your own. That can be very complicated and confusing. Option B is simple and strategic. Let's work together and get this fixed. We are offering a free discovery call so you can discuss your case with us. Simply click on the link at the end of this video. It will take you to this schedule screen so you can pick your time for the discovery call. After you pick the time, you will put your contact information in so we can call you at the correct time. You will then see a confirmation page, and then you're all set. You are ready to start taking control of your health problem. Your future self will thank you. I would like to debunk some of the myths that we hear occasionally. The first one is, I've tried everything. This is a phrase that we often hear on our discovery calls. Many patients feel like they've done everything that they can to get better. However, within a few short minutes, it becomes clear that there are many stones still unturned. When a person submits to the thought of having tried everything, they subconsciously submit to the idea that nothing more can be done. Most people we speak to have never had a functional lab testing, a lifestyle analysis, or an assessment of their living space, all of which can be fundamental to the healing process. Chances are there are many aspects of your health that have not yet been fully explored. Myth number 2. If this worked, my doctor would know about it. Allopathic medicine operates out of a completely different paradigm than functional medicine. Allopathic medicine focuses on the name of the disease and implements a one-size-fits-all approach that centers around symptom management and pharmaceutical drugs. This is fine for acute care or emergency interventions to help you feel better in a traumatic or life-threatening situation. However, in long-term chronic care circumstances, treating a disease through symptom management never leads to true healing and can often end up exacerbating the problem. In stark contrast, functional medicine is more focused on uncovering the root causes of your health issues and providing a personalized plan to correct them and help you actually get better. We help coach up your adaptive physiology by treating the entire body as a whole, integrated unit that has the ability to self-heal once it is properly balanced and provided the correct inputs. We also believe there is a time and a place for intelligent allopathy, and will recommend it accordingly if we feel it's necessary. Myth 3. I don't have the time. We are all allotted the same time amount in a day, and that time passes whether you're healthy or sick. Few things are more wasteful than time spent managing an illness or disease. Think of all the hours spent online researching your illness or sitting in a doctor's waiting room for a 15-minute visit. When you don't feel well, you're also less productive at work, and that can impact your finances, which leads to more time wasted spent worrying about your bottom line. We believe that being healthy is one of the best ways to free up more time for you to do the things you enjoy the most with the people you love the most. In order to help you make the most of your time, we offer the option and convenience of telephone and video consultations to provide you with clear, concise directions on how to finally take control of your health and your life. The next 24 hours are going to pass regardless of what you do. Why not spend them pursuing better health? Myth 4. Functional medicine is expensive. This is the biggest misconception about functional medicine, primarily because we've been conditioned to expect insurance to pay for everything. In doing so, we have unwittingly ceded control of our wellness over to the lowest bidder at the expense of our own health. In reality, functional medicine is one of the most affordable forms of healthcare on the planet, especially when you consider that the average person spends more money in their lifetime in the allopathic model managing a disease or an illness without ever truly healing. Thankfully, some forward-thinking insurance companies and governments are now running pilot projects to demonstrate the significant cost savings to both patients and healthcare systems using a functional medicine model, while at the same time helping participants achieve increased positive, healthy outcomes. Sometimes the true cost of services being rendered isn't just measured in dollars and cents. And just because something is covered by your insurance company does not make it cheaper. We're proud of the fact that our patients save thousands of dollars each year in medical expenses, while at the same time learning a liberating life skill that can be taught to their children and loved ones. When choosing a healthcare provider, it's important to look beyond the cost of something and instead consider its value. In this manner, functional medicine wins every time. Myth 5. I can figure this out on my own. We live in an era of information, and the entirety of the world's knowledge is available at your fingertips. Yet the most valuable information you need for true healing is the knowledge of what's going on inside your body. And until now, you weren't allowed to access this information without the permission of your doctor or insurance company. The Midwest Functional Medicine team is trained to ask you the right questions and order the right lab testing to provide you with a deeper insight into your personal health challenges and how to overcome them. Functional lab testing clues you into information that you or your doctor would never know otherwise. Our goal when partnering with you is to help identify the root cause of your health problem, teach you the appropriate life skills you need to remedy them, and support you as needed. Self-navigating through the sea of conflicting information ends up costing you both your health and your sanity. We don't recommend it. So here's the reality. Even if you only use the tiny fraction of what we covered today, don't you feel like you've taken a gigantic leap forward in understanding your condition? Is it safe to say that you learned something new and valuable? New and valuable information does not change your life. New decisions do. So here are your options today. We hope that you will schedule a free 20-minute discovery call. Even if you're just starting out, even if you're unsure if our approach is the right fit, we'll schedule a 20-minute call about your specific needs, and we'll discuss the next steps. So all you need to do is to click on the discovery call link at the end of this video, or you can click on the new patient application link at the end of this video.